Merci beaucoup, Madame.
Thank you very much. We thank you for your guidance and your commitment at the 75th Regional Committee for Africa.
Next, please allow me to invite His Excellency Mr. Aboubakry Diaw, Chief of Staff of the United Nations Economic Commission for Africa, to give his remarks. Let's welcome him to the podium.
Your Excellency Taye Atske Selassie, President of the Democratic Republic of Ethiopia, Your Excellency Mahmoud Ali Yusuf, Chairperson of the African Union Commission, Dr. Tedros Ghebreyesus, Director General of the WHO, Honorable Dr. Mekdes Daba, Minister of Health of Ethiopia, Honorable Dr. Assa Bajalo Toure, Minister of Health and Social Development of Mali, and Chairperson of the 75th Regional Committee, Dr. Mohamed Yacoub Janabi, WHO Regional Director for Africa, Honorable Ministers, Excellencies, distinguished delegates, ladies and gentlemen. I have the honor to address you on behalf of Mr. Clave Gatete, United Nations Under Secretary General and Executive Secretary of the UN Economic Commission for Africa. And your President, Mr. President, sends a powerful message. Health is not the responsibility of one ministry. It is a whole of government priority, a foundation of Africa's economic transformation. There could be hardly a more meaningful venue for this ceremony than the Adwa Museum. Adwa is first and foremost the story of citizens who united to defend their country's sovereignty. Yet its meanings traveled far beyond Ethiopia, becoming a continental symbol of African dignity, agency, and determination to shape our own future. That spirit remains relevant to our health agenda today. Health sovereignty means Africa having the capacity to define its priorities, to finance its systems, to manage its data, to produce essential health products and protect its people through future shocks. The spirit of today's ceremony, Roots and Wings, captures this ambition. Our roots are Africa's tradition of solidarity and collective responsibility. Our wings are innovation, digital transformation, and the confidence to design solutions suited to our own realities. But before systems, budgets, and instruments, let me talk about one person. We can call her Amina. Amina owns a small business, catering business in an African city. She employs 2 young people and supports her children. When Amina becomes ill, she delays care because she fears the cost. When she finally seeks treatment, her condition has worsened. She uses her savings and sells part of her business equipment to pay the bills. Her business slows, her employees lose income, and her children's schooling is at risk. What began as one person's illness has become a household financial crisis, a small business crisis, and when repeated across millions of families, a macroeconomic problem. Amina's story reveals 3 challenges confronting sustainable health financing in Africa. The first is a resource model under severe pressure. External health assistance declined by almost 30%, while in the median low-income countries, debt servicing now consumes 7.5% of public expenditures, more than the 6% allocated to health. The second issue is fragmentation and weak financial protection. Out-of-pocket payment account for an average of 30% of current health expenditures in the region, well above the WHO benchmark of 20%. In the last available estimates, 150 million people were pushed into poverty or deeper poverty by direct health payment. This is the toll of a single year. The third is an implementation and confidence gap. Countries have developed health strategies, but these are not always translated into costed, sequenced, and fiscally credible investment propositions. Weak budget execution and limited financial information make it harder to attract public, development, and especially private financing. Africa's health sector does not suffer from only a financing gap. It also suffers from a confidence gap, and confidence, unlike capital, cannot be borrowed. It must be built. Through the African Initiative of Transforming Health Africa, launched in Tangier in April 2026, and supported by Dr. Senait and the Susan Thompson Buffett Foundation, ECA is bringing macroeconomic analysis and public finance expertise into the health discussion. We are supporting country diagnostics and investment cases that link health to productivity, jobs, fiscal resilience, and growth. Our primary analysis recognizes that the answer is not simply to raise more money. Better, pool better, purchase better, and account better. From ECA's perspective, this requires three fundamental shifts. First, we must reposition health from a recurrent social expenditure to a productive economic investment. And how do we achieve this? By quantifying the economic cost of inaction and the returns generated by prevention and stronger health systems. By integrating health priorities into national development plans, in macroeconomic forecasts and medium-term expenditures frameworks, and by linking budgets to measurable health and economic outcomes. We will partner with ministries of health and finance so they come to the budget table not only with a statement of need, but with a credible investment case. The second shift is from fragmented plans and parallel institution discussions to nationally owned health financing compacts. A compact is much more than coordination between ministries of health and finance. It is a politically endorsed national agreement that establishes the outcomes, the reforms, the resources, and who finances what, and how delivery is measured. It must bring together health, finance, and planning authorities, including revenue administration, debt offices, insurers, banks, private partners, civil society, around one credible national proposition. Putting more money into a fragmented system can finance more fragmentation. But putting money behind a credible national compact can finance transformation. With our early adopter countries, we are building these pathways now, diagnosing constraints, identifying feasible reforms, and sequencing what comes first. Our preliminary work with the early adopters countries shows that health received only about 5 to 9% of government budgets, while direct household payment can reach 64% of the health expenditures in some countries. The preliminary lesson is clear. There is no single financing solution. Each compact must combine budget reprioritization, stronger pooled prepayment, efficiency reforms, and a managed transition from external financing calibrated to the country's fiscal and institutional starting point. The third shift is from financing instruments in search of projects to country priorities matched with the right instruments. A country facing low budget execution may need public finance reform before it needs new financing mechanisms. A country transitioning from external assistance may need a carefully sequenced domestic financing pathway. A country seeking to manufacture medicines may require pooled procurement, regulatory harmonization, guarantees, and predictable regional demand. Innovation must therefore begin with the country's problem, not with the instrument. On mobilizing private capital, and here the compact earns it keep. Investors need a lot of things, but there are three things that they need most: predictability, policies that hold, and government that pay on time. They need a pipeline, costed, investment-grade price. They need information, reliable data on gaps and returns. Compact diagnostics and transparent data can supply exactly that. So with the development finance institutions, they let us structure the blended and de-risking instruments that bring African pension funds, insurers, and banks into health. Partners who strengthen public system that never substitutes for public responsibility. Digital transformation must be treated as part of this financing architecture and not as a separate technical agenda. When health and financial systems speak to each other, they connect the patient, the facility, and the national budget and show in real time whether spending is producing results. They turn efficiency and transparency from aspiration into daily practice. Digital health is not simply about replacing paper with screens. It is about replacing fragmentation with visibility. It is replacing leakage with accountability. And it is replacing uncertainty with trust. Today, fewer than 1/3 of health systems in low-income settings can track expenditure digitally in real time. Closing that gap is among the fastest efficiency gains available to any treasury. The leadership of His Excellency Prime Minister as the African Union champion for artificial intelligence and digital health is central to this transformation. Ethiopia can demonstrate how digital identity, interoperable health information, real-time expenditure tracking, and data-driven, increasingly AI-enabled decision-making can strengthen both health outcomes and fiscal accountability. When every birr or every franc can be traced from the national budget to the health facility to the patient, digital health stops being a project and becomes a financing revolution. Excellencies, the respective strengths of WHO and ECA are highly complementary. WHO brings public health leadership, normative guidance, and deep presence in national health systems, and ECA brings macroeconomic analysis, public finance, and the institutions that shape budgets and investment decisions. Together, we can help transform health strategies into credible national investment propositions while protecting equity and public purpose. The ultimate measure of success will not be the number of declarations adopted or the amount of money announced in conferences. It will be whether Amina can seek care early, can receive quality treatment, and return home without selling the assets that sustain her family. It will be whether her employees keep their jobs, her children remain in school, and her business continues to contribute to the economy. Universal health coverage becomes real the day seeking care stops costing a family its future. Health is not what we spend when Africa grows. Health is how Africa grows. Here at ADWA, history reminds us what Africa can achieve through agency, solidarity, and shared purpose. Let us bring the same determination to financing the health for our people. ECA stands ready to work with WHO, with the African Union, with member states, the Africa CDC, and financing institutions, technical and development partners to turn this ambition into financed and measurable and sustained action. I thank you.
Thank you very much, Your Excellency, Mr. Aboubakry Diao, Chief of Staff of the United Nations Economic Commission for Africa. Thank you for your statement. Now, the next speaker will come to you virtually. So allow me to introduce our next speaker, His Excellency Dr. Tedros Adhanom Ghebreyesus, WHO Director General, is joining us virtually. Your Excellency, you're on.
Thank you. አመሰግናለሁ ማስተር ኦፍ ሴርሞኒ Your Excellency ታዬ አጽቀሥላሴ ፕሬዝዳንት ኦፍ ኢትዮጵያ ክቡር ፕሬዝዳንት ታዬ አጽቀሥላሴ በአካል በመገኘቱ ስብሰባችን ላይ በጣም አመሰግናለሁ And Your Excellency Mahmoud Ali Yusuf chairperson of the African Union Commission the Honorable Dr. Assa Badialo Toure, Minister of Health and Social Development of Mali and Chairperson of the 75th Regional Committee, the Honorable Dr. Magdes Daba Faisa, Minister of Health of Ethiopia, Honorable Ministers and Heads of Delegation, and my friend and Regional Director, Professor Mohammed Janabi, dear colleagues, with you in person today. And I thank the government and people of Ethiopia, especially to His Excellency the President, for hosting this year's regional committee meeting. And I thank my friend Professor Janabi for his first full report as regional director, documenting one of the most demanding and significant years in the region's recent history. Despite the deepest cuts to international health financing in a generation, our region achieved significant gains last year. 8 countries, including Algeria, Burundi, Cabo Verde, Guinea, Kenya, Mauritius, and Senegal, reached major disease elimination milestones. And more than 28 million doses of donated NTD medicines were delivered despite a funding freeze, including in DRC, which carries the world's largest burden of sleeping sickness. An estimated 21.7 million people living with HIV were kept on uninterrupted treatment with Botswana, Eswatini, Lesotho, Namibia, Rwanda, Zambia, and Zimbabwe already reaching the 95-95-95 targets. And TB treatment coverage recovered to 74%, up from 52% in 2020, with Uganda now treating more than 90% of estimated cases. The big catch-up reached more than 18 million children who had missed vaccines, and WHO has supported the rollout of the malaria vaccine to 25 countries. In Burkina Faso, cases have already fallen by nearly a third. 6 new countries introduced HPV vaccination, and Cabo Verde, Mauritius, and Seychelles became the first sub-Saharan countries to achieve verified measles and rubella elimination. On mental health, 4 million more people in Ghana and Zimbabwe gained access to services, and outbreaks are being detected and contained faster. And Ethiopia's Marburg outbreak and DRC's previous Ebola outbreak were both contained within 90 days. My congratulations to all member states and staff for these achievements. But as we all know, the region continues to face multiple challenges. Families still pay a third of all health spending out of pocket. Cholera reached a regional record of more than 245,000 cases. 44 of 47 countries cannot reliably record why their people die. And about 70% of maternal deaths and almost half of under 5 deaths globally are in our Africa. We also meet against the backdrop of an Ebola epidemic in DRC, the second largest in history, spreading faster than any before it, with more than 5,000 infected and over 2,400 dead across 6 provinces. The epidemic had already reached Uganda before we knew of it, though Uganda's decisive response stopped it there. With the government of DRC, Africa CDC, and partners, we're scaling up the response. And we're also advancing clinical trials of 3 vaccines and 3 treatments. But many chains of transmission remained unfound. We must also remember that Ebola is only one of the threats the people of the DRC face, which is why our top priority must remain strengthening health systems at the foundation of universal health coverage. That task has become harder due to the deep cuts to international financing many countries faced last year. This was not gradual. Life-saving programs lost their footing almost overnight. Clinics closed, and health workers lost jobs. HIV, TB, malaria, NTD, and maternal and newborn care programs were hit hardest. Your secretariat has supported member states to mobilize domestic resources, including health taxes. 15 reformed tobacco taxation last year. South Africa now funds 3/4 of its HIV response domestically, and Nigeria increased domestic TB funding. In this crisis lies an opportunity to leave aid dependency behind and build health sovereignty, self-reliance, and solidarity. And I'm encouraged to see the many initiatives many countries in our continent have started. Your agenda this week responds directly to these challenges. The strategy for financing the future of health sets out how the region can move over the next decade from dependency to domestically financed systems. The Africa Health Workforce Agenda confronts the chronic shortage of health workers, and the regional strategy on regulation of medical products lays a foundation for local manufacturing. This builds on the work that WHO has done to strengthen local production through the mRNA Technology Transfer Hub in Cape Town and the technical and financial support we have given to the African Medicines Agency. I congratulate Ethiopia and today Mozambique for reaching regulatory maturity level 3. Strong local production also lets us accelerate action on antimicrobial resistance. Colleagues, the items on your agenda are not separate documents. Guided by your vision, a new era of health for Africa, they are the blueprint of the future you're choosing, one defined by sovereignty and solidarity. The past year has been one of profound change for WHO too. Although the cuts we faced were a shock, they were a shock we had predicted and prepared for. And when we began the WHO transformation in 2017, we identified our over-reliance on a handful of donors as a major risk. We proposed a plan and approved in 2022 to raise assessed contributions to 50% of the base budget from just 20%. As you know, the first increase came in 2023, the second in 2025, and 3 more are planned for 2027, 2029, and 2031. We also broadened our donor base through the WHO Foundation and our first investment round, and I thank the 22 member states from Africa that contributed to the investment round. Thanks to these measures, we have mobilized 92% of the resources needed for this biennium 2022, 26, and 27 bienniums based budget, our best position at this stage of a biennium ever. But because most voluntary contributions and reached a point of stability, more focused and more independent. And this happened because of your support. At the same time, we must remember that WHO is only one part of the global health architecture. And last year's cuts exposed weaknesses that must be addressed. At the World Health Assembly in May, member states tasked the Secretariat with hosting a joint reform process that's country-centered, inclusive, and transparent. A task force has been established and will report later this year. WHO approaches this with humility as a convener of equals. Your Excellency, President Taye Atske-Selassie, Excellencies, dear colleagues and friends, let me leave you with 5 priorities for the next year. A to-do list, if you will. First, finalize the PABS Annex so the pandemic agreement can enter into force. Second, approve the next increase in assessed contributions at next May's World Health Assembly that will continue to increase the sustainable financing for the organization. Third, engage proactively with reform of the global health architecture and shape one that works for you. And fourth, support the Ebola response in DRC. And fifth, build on WHO's transformation and continue shaping a leaner, sharper organization that delivers results where it matters most, in your countries. As you know, and as my colleague and friend Professor Janabi said earlier, this is my final regional committee meeting as Director General before I finish my tenure in August 2027. When I first addressed this committee in Zimbabwe in 2017, I said member states must be in the driver's seat. They should own their agenda. 9 years on, that's becoming the principle on which Africa finances, governs, and delivers its own health. Our Africa is at an inflection point. For many years, we have relied on foreign donors, and of course we are grateful. But the truth is, Africa loses far more than it receives. Each year, the continent loses an estimated $90 billion to illicit financial flows, more than the $74 billion it received in official development assistance in 2023. While governments now spend more servicing external debt than they receive in aid, $163 billion last year, with more than half of countries spending more on interest than on health. If we can curb illicit financial flows, secure fair debt terms, and make full use of health taxes alongside other domestic reforms already underway, Africa will have more than enough resources to finance the health of its own people. This is the new era we must build, one defined and financed by Africa for Africa, in which together we build the Africa we all want, a healthier, safer, fairer Africa. And I thank all member states and all colleagues in the regional and country offices for your support and everything you have done and continue to do. It has been the greatest honor of my life to serve as your Director General, and I hope you will continue to support me on the vision I have stated for the next 1 year until 2027 August, when I leave office. I thank you, and Madam lead of the ceremony. Back to you. Thank you.
Thank you very much, Your Excellency Dr. Tedros Adhanom Ghebreyesus, the World Health Organization Director General. Thank you for giving us your time and also for your commitment. Now we will be back to the next speech that will take place from the meeting hall. Please help me in inviting His Excellency Mahmoud Ali Yusuf, the AU Commission Chairperson, to give us his remarks. Ladies and gentlemen, Your Excellencies, let's warmly welcome the Chairperson of the African Union Commission, His Excellency Mahmoud Ali Yusuf.
Bismillah ar-Rahman ar-Rahim. Excellence, Monsieur Taye.
Excellency Mr. Taye Atke Selassie, President of the Federal Democratic Republic of Ethiopia, Excellencies, ladies, gentlemen, ministers, Mr. Mohamed Janabi, Regional Director, WHO, Excellency Dr. Tedros Adhanom, Director General, WHO, ladies and gentlemen, it's a great honor for me to take part in the 76th session of the Regional Committee of WHO for Africa. I'd like to thank the government of Ethiopia for this warm welcome, as well as the WHO, strategic partner of the African Union. Ladies and gentlemen, health is at the core of our priorities. We are facing health crises such as Ebola, cholera, measles, HIV, and tuberculosis. There are also challenges related to non-communicable diseases, which are consequent. However, the challenges are many. For example, we have infrastructural issues, lack of financial and human resources or qualified resources. However, we also have our own wealth. We have a strategy, an African strategy for health for 2030. Certain African countries have national capacities, and this illustrates my point. Producing vaccines vaccine production in Africa is increasing. We are creating conditions for health sovereignty, and that is why we launched, the AU launched its medicine agency in order to promote standards and the budget share for health increases each year with this strategic partnership with WHO. Our ambition is to strengthen our collective ambition in order to prevent, detect, and control health threats. Africa must have a stronger voice in the global arena. Let me express three priorities. First of all, we must mobilize more financial resources, domestic financial resources for health. Secondly, we must accelerate vaccine production capacity as well as treatment capacity in Africa. Thirdly, we have to lift barriers in Africa, in the African market, and through AFCFTA, strengthen our various chains.
Explore all possible means to reach self-reliance, from financing to local production and research and innovation. This year, African Union theme is articulated around water and sanitation, and we all know the critical importance of clean and abundant water for the health of our communities. Your Excellencies, African health sovereignty starts with effective national health systems. The African Union Commission remains fully committed, alongside with our member countries and continental institutions towards that goal. I'm convinced that the African Union, WHO, our partners, we will stand here to renew our collective engagement towards more coherence, better implementation, and gradual self-reliance. I wish you full success for your deliberations. I thank you.
Thank you very much, Your Excellency Mohammed Ali Yusuf, Chairperson of the African Union Commission, for your statement, for your presence, and for your leadership. So the first part of the statements and the speeches were, you just listen to them, and let's take a break. But when we take a break, as I said earlier, it's gonna be very exciting because we incorporate art, culture, and live narrative performance so that we will express not only our culture, but also telling the stories through visual and performance arts. So the next part will be a narrative performance entitled The Digital Leap, Building Resilient Health Systems. It's an awe-inspiring circus performance combining acrobatics, physical theater, and dynamic visual art. The show symbolically illustrates the power of digital health solutions, human strengths, and technological innovation in overcoming health crisis and building resilient, future-ready health systems across Africa. This narrative performance will be delivered by G8 Entertainment. Ladies and gentlemen, before I come back to introduce the second part of the speeches, I will now give you G8 Entertainment to present their really inspiring and interesting circus performance. Let's warmly welcome them.
declared a state of emergency in response to the coronavirus pandemic.
የኮሮና ቫይረስ ወይም ኮቪድ-19 የሚባለው ይህ ወረርሽኝ ድንበር የማያቆመው ቀለም የማይለይ ጾታ የማይለይ ሀብታም ድሃ የማይል ትልቅ ትንሽ የማይል ሁሉንም የተባበረ የሚከላከለው
WHO has been assessing this outbreak that COVID-19 can be characterized as a pandemic.
Whew, what a performance. Actually, I was trying to guess which one of you are medical doctors and which one of us are not, because I see some of us are really shrinking, reacting different ways not to see, but then the medical doctors are like, we got you if anything happens. So that is the difference, I guess. But thank you so much. That was G8 Entertainment presenting Narrative Performance, the Digital Leap, Building Resilient Health Systems. And they told the story beautifully, right? Yes. Now we come to the second and last part of this opening ceremony. To give us her welcoming remarks, and also, after she finishes her remarks, to invite our guest of honor, His Excellency Ambassador Taye Asqasilase, President of the Federal Democratic Republic of Ethiopia. Please, Your Excellencies, ladies and gentlemen, put your hands together for Her Excellency Dr. Mekdes Daba Fayisa, Minister of the Ministry of Health of the Federal Democratic Republic of Ethiopia. Your Excellency, thank you, and the floor is yours.
Your Excellency, President Taye Asqasilase, President of the Federal Democratic Republic of Ethiopia, Your Excellency, Mohammed Ali Yusuf, Chairperson of the African Union, Excellency Dr. Tedros Adhanom, Director General of the World Health Organization, Professor Mohamed Janabi, WHO Regional Director for Africa, Honorable Colonel Assa Badilo Touré, Minister of Health and Social Affairs of Mali and Chairperson of the 75th Regional Conference for Africa, Honorable Ministers, State Ministers, Honorable Heads of representatives of governmental and non-governmental organizations, ambassadors, chairs of our Parliamentarian Health Standing Committee, distinguished guests, ladies and gentlemen, እንኳን ደህና መጣችሁ. Welcome, bienvenue to Ethiopia. It is a great honor and privilege to welcome you to Addis Ababa for the 76th session of the World Health Organization Committee for the Regional Committee for Africa. For Ethiopia, this occasion carries a special significance because Ethiopia has an honor, and we were honored to host the Regional Committee 3 times before. The first one was on the 14th session back in 1996. The second was for the 56th in 2006, and in 2006, and the 16th in 2016. And today, we are pleased again to welcome you back to your home for the 76th session, once again to Addis Ababa, the capital of Ethiopia, and the capital where our heads of states meet. Welcome again. There is something special about this rhythm, because every 10 years, this community returns to Addis Ababa. But yet, each time we return as a different Africa with new realities, new challenges, and new opportunities before us. Africa has made remarkable progress in health over the past decades. We have expanded access to essential services, strengthened our public health institutions, saved millions of lives. But this time is different because we are meeting just after COVID. But the landscape before us is changing, and we face persistent inequalities, constrained resource, emerging technologies, climate challenge, demographic transitions, and increasing complexity of health emergencies. This moment, therefore, calls not simply for more of the same, but for renewed way of thinking about how we will build a sustainable health system for Africa for tomorrow. For Ethiopia, this conversation is grounded in a health transition that has taken place over decades, and the results are becoming visible. Excellencies, we Sorry. Technology is with me. Bear with me as I navigate through my technologies. S'il vous plaît, excuse me, በጣም ይቅርታ ሁላችሁንም. Because the results are speaking, as maternal mortality has declined from 871 per 100,000 live births to current data of 141 per 100,000 live births. This data I'm speaking is from 2024-2025 Ethiopian Demographic Health Survey. Under 5 mortality has also reduced from 67 to 51 per 1,000 live births. This is since 2016, since we met last time for the 10 years back. And this has also, we have also seen a significant reduction in child wasting from 10% to 5% over the same period. Primary health care coverage has increased from 64% to 86.3%. And it's also we also brought this to a single digit as a significant achievement. We started to record number of patients visiting our OPDs. This year, over a year period, there were 233 million patients visiting an outpatient per year. Our health workforce has also expanded from 212,185 to a current data we have being around 325,000. This is just specifically about health professionals, but the support staff also increases, and we have more than almost 500,000 around it. These are not simply numbers, but they represent mothers who survived childbirth, children who lived to celebrate their 5th year birthday, communities with access to care, and health workforce serving our people day and night. Building sustainable and resilient health system, but also accessing a loan is our priority. A health system must also be financially sustainable. A community-based health insurance, our health system insurance has reached 91% of Waradas, and currently more than 69 million people are insured in our community-based health insurance. The principle is simple, because health cannot be sustainable without financing it, and we must mobilize domestic resource, improve efficiency, strengthen our financial protection, because this is not just an argument about partnership. There has been a lot of discussion even yesterday if there is some change on the partnership view we have from countries on partnership, but we are saying that it should be strengthened. And it's once again about if partnership which are going to be externally resourced will help our countries to build a lasting domestic capacity rather than permanent dependency. The same principle applies to medicines, vaccine, health technologies, because the recent global experience has reminded us that health security cannot rest entirely on supply chain beyond our control. Africa must increase and is increasing its capacity on Africa's need. In Ethiopia, the domestic market share of local manufacturers and local medicines for health products has increased from 8% to current data of 44%. And I'm proud to say this is being replicated and done by most member states, and so proud to stand before you with member state ministers who are always advocating for this. Thank you so much for standing with us and for being a witness to this. Our regulatory authority, AFDA, has reached WHO maturity level 3. For us, localization is therefore more than industry policy. It is about health strategy. And we are also entering into a new era, digital health and digital sovereignty. In Ethiopia, community health records through Ethiopian Community Health Information System has expanded from 112,000 back 7 years back to current data of having 7 million households. This is more than 33 million people data on our hands to have a real-time data to have a decision. But technologists must serve our people, and a woman living in a remote community must benefit from digital transformation just as much as someone who's living away from the capital. That is why equity means digital age. What equity means in digital age is going to be the same for us, because everyone, be it urban or rural, should get same opportunity. Our experience with COVID-19 and other emergencies has also taught us that preparedness cannot wait for us, and we can't wait for the aftermath. Ethiopia has increased outbreak detection capacity from 65% to 95%, while rapid response team coverage has increased from 75% to 93% now. The next emergency will not wait for us, and we have to get prepared. Preparedness must therefore become part of our architecture for health system. Our scale for quality should improve, because our achievements of giving confidence to our community will only come to be a responsibility to be shared if we're not just expanding numbers, but focusing on quality. We have demonstrated that we can build in scale, but the next phase is about turning the qualities into the hands of our community. At the center of all the transformation I talked about is about our primary health care, our community, and our community health workers. Universal health care coverage will not ultimately be achieved if communities and households and health centers are not making people a first priority, and Ethiopia is committed to do this with our member states. Technology can help us reach further, financing can sustain service, but a stronger workforce can improve quality, but the local manufacturing strengthening will not be achieved if we are not still focusing on our community. But all these efforts must ultimately serve one purpose. It is about every person accessing where they are and what they need as close as their home. From communities to action excellencies, we gather at an important moment for African history, because the question before us is no longer whether Africa has the knowledge, whether Africa has the talent, or the determination to build a stronger health system. We do. But the question is whether we have a collective resolve to turn our potential into a lasting change. Let us therefore use this regional committee not simply to adopt strategies, but to renew our determination to implement what we've been discussing. Let us invest in our people. Let us strengthen our primary healthcare system, sustainable healthcare financing. Let's strengthen our local production as a whole for the region, African health security. We will need to also embrace digital transformation while keeping equity at the center. Ultimately, the success of our health system will not be measured by the number of strategies we adopted or the technologies we introduced. It will be measured by whether a mother has received care when she needs it, whether a child is protected from preventable diseases, whether our health workforce has a tool that would support their job, and whether every Africa has a fair opportunity to live a healthier life. Africa's health future will not be built by one country or one institution or one technology. It will be built by our African sisters and brothers, us together. If we act in solidarity, invest with purpose, and innovate with equity at the center, we can build Africa that is healthier, more resilient, more self-resilient, and better to prepare and shape its future. On behalf of the government and the people of Ethiopia and the Ministry of Health, I warmly welcome you once again to Addis Ababa. I wish you a fruitful deliberation and a meaningful engagement, but above all, a decision that will translate to a better health and a better life for our community in Africa and beyond. Thank you very much, and allow me to also call His Excellency President Taye Atske-Selassie, our guest of honor, to come to the stage and deliver his speech and open the 76 RC officially. Ladies and gentlemen, please welcome our guest of honor to the stage.
Thank you, Dr. Makdas, for that introduction. Your Excellency Mahmoud Ali Yusuf, Chairperson of the African Union Commission, Your Excellency Dr. Makdas Daba, Minister of Health, Excellencies Ministers of Health, Excellency Dr. Tedros Adhanom, Director General of the World Health Organization, Your Excellency Dr. Mohammed Janab, WHO Regional Director for Africa, ambassadors and members of the diplomatic corps, distinguished delegates, and also I have seen a couple of distinguished representatives from various international organizations and foundations, and also multilateral institutions. Ladies and gentlemen, a very good morning. It is my distinct honor to welcome you to Ethiopia for the 76th session of the WHO Regional Committee for Africa. As has been eloquently expressed by previous speakers, today Africa stands at a pivotal moment. We face a rapidly shifting global environment where health financing is becoming unpredictable. Geopolitical instability tests our multilateral institutions, and disease outbreaks continue to threaten lives and economic stability. At the same time, climate change is exerting an unprecedented pressure on our communities, while conflict disrupts vital health services, displace vulnerable population, and trigger cross-border humanitarian crisis. Yet, these profound challenges offer a historic opportunity for Africa to strengthen its collective voice, deepen regional cooperation, and assume full ownership of its health architecture. The decisions we make here today must extend far beyond technical discussions. They must directly advance Agenda 2063, a continental vision that aspires to build an Africa which is healthier, more resilient, and united. Distinguished participants, as we chart this path, allow me to highlight key milestones in Ethiopia's health sector that demonstrates the power and value of sustained national investment and structural reform. Ethiopia prioritizes health as a strategic national investment, leading to steady budget increase despite competing economic demands. Particularly, decades of investing in primary health care have brought essential health services directly to communities and expanded access for millions. We also forge a healthcare workforce expansion which has subsequently driven significant progress in maternal, newborn, and child survival rates. In view of addressing climate-driven health risks, Ethiopia's Green Legacy initiative, spearheaded by Ethiopia's Prime Minister, has mobilized millions of citizens to plant billions of trees. Just, might have checked the headlines. Just 3 weeks ago, on August 3rd specifically, our country demonstrated this commitment by planting over 800 million seedlings in a single day as part of our target of planting 8 billion seedlings for this year alone. We thought it was a kind of a far-fetched initiative, and we didn't expect that we would reach this level. Now we have so far planted about 56 billion seedlings since the initiative began in 2019. I don't know when we are going to stop, but we'll keep on planting. Furthermore, the modern transformation of Addis Ababa that you see today is driven by this vision itself, creating a cleaner, healthier urban environment to elevate the overall health and living standards of our people. Ethiopia recognized that sustainable health system cannot exist without peace. Just this past Sunday, Ethiopia marked a major milestone of an inclusive national dialogue featuring over 4,000 delegates with a wide range of political views. That is indeed a major stride in Ethiopian political landscape. We strongly believe that through dialogue and reconciliation, we are securing the stability of our country and the wider region. Excellencies, international cooperation remains indispensable, but the strongest partnerships are those that reinforce national leadership, strengthen domestic institutions, and empower countries to sustain their own health priorities. The Accra Resets, with its emphasis on stronger country ownership, offers a critical opportunity to rethink how global assistance supports national vision. But Africa's ambitions must go further. We must not simply adapt to reforms designed elsewhere. Africa must be able to shape its own agendas by her own. From Cape Town to Cairo, from Dakar to Djibouti, from Nairobi to Rabat, and from Malabo to Mauritius, and all over Africa, we possess the potential and the will to safeguard the health and well-being of our people. What we must now forge is a very clear and bold, unified strategy centered on the following, perhaps 5 strategies. The first one is achieving financial self-reliance. Africa must progressively increase domestic public investment in health, shifting from external dependency to predictable national financing models. The urgent need to accelerate local manufacturing is the second priority. Health security demands that we produce our own medicines, vaccines, and diagnostics. What a worse time in 2019 and 2020 to learn from the onslaught of the COVID pandemics. I was living in the center of the COVID pandemics in New York City, where we saw that how helpless and hopeless as human beings were, where people just simply get sick and perish. That happened in the midst of those who stand that and believe in the strength of humanity on the one side, and those who denied that this pandemic was just simply a fake. So it shows us how important it is that we have to have a predictable and much more strong investment in the health sector, particularly in vaccines and whatnot. The third one is harmonizing institutional roles. We must ensure operational synergy between the WHO and the Africa CDC. The WHO's global technical leadership and Africa CDC's continental mandate must complement each other, eliminating parallel systems and prioritizing country-led execution. Our fourth priority could be institutionalizing strategic solidarity. We must move beyond symbolic unity and establish real-time mechanisms to share expertise, laboratory capacity, and emergency supplies instantly when a neighboring nation faces a crisis. I have drawn extensive lessons along this line. I just overheard earlier in the morning one of my colleagues saying that whenever developed countries decided to pull the rug under your feet for any reason, they don't need even to explain it. Developing countries, and particularly Africans, suffer the most. So it is important that we have to institutionalize a strategic solidarity between our African countries and also other developing countries. The last one is Africa should lead the climate health agenda. As you all know, Ethiopia is bracing up and preparing to host COP32 here in Addis Ababa in 2027. This is a huge opportunity where Africa must arrive with a unified position, a common stance that places climate resilience health system and adoption funding at the core of global policy. Excellencies, the question before us are fundamental. Let me pose a couple of them. These are who really sets Africa's health priorities. A lot of story to tell around this line. Who finances them? And who delivers results of our people? The answer must always be, it should begin with African leadership itself. Indeed, national governments must lead, regional institutions must support, and global organizations must scale up their follow-up, coordination, and technical leadership. Africa's next health chapter must be defined by ownership over dependency, integration over fragmentation, and practical action over words. Ethiopia stands fully prepared to play its part through national investment, regional cooperation, and unwavering support for our continental institutions. Excellencies, let us leave Addis Ababa not only with declarations, but with firm commitment and measurable actions. On behalf of the government and people of Ethiopia, I wish you fruitful deliberations, and it's now my distinct privilege to declare the 76th session of WHO Regional Committee for Africa officially opened. I thank you.
Thank you very much, Your Excellency Ambassador Taye Haile-Selassie, President of the Federal Democratic Republic of Ethiopia. Thank you for honoring us with your presence. Your Excellency, dignitaries, speakers, and member state ministers, please follow our team, our protocol, to have a photograph session and to lead you to the next room, the VIP room. Your Excellencies, thank you very much. The rest of us will stay here because I have few more announcements for you. But please send off our guest of honor, His Excellency Ambassador Taye, the President of Ethiopia, Her Excellency Dr. Mekdes Dawa, Minister of Health of the Federal Democratic Republic of Ethiopia, our esteemed speakers, and also ministers of the 47 member states of WHO Africa region. Once we lead them, and also our parliamentarians will join them, and the rest of us, we have one more thing for you. We will show a documentary, and after the documentary, I will come back for the housekeeping items and also to give you a few announcements for the rest of RC76. So now RC76, the WHO Regional Committee for Africa is officially opened, and we will carry on. Our participants, guest of honors, please take your seats as we continue with one last component of this official opening, and the documentary. It's a very short, it will start playing now.